Welcome back. While the federal government is closing Obamacare or the Affordable Care Act, their exchanges are opening. Millions of uninsured Americans are now able to select a policy that is supposed to best fit their needs online. Or are they? Americans are far from convinced Obamacare is going to help them. A new CNN ORC poll out this morning shows that only 17% of Americans believe their family will benefit. Better than 70% say it will help other families or nobody. So let's try to get some clarity here. CNN's chief medical correspondent, Dr. Sanjay Gupta, is in Greenville, South Carolina, where 1/5 of the state's population lacks health insurance, part of the CNN Express, the bus tour to help explain these things. Doc, great to have you. First question. Few Americans think Obamacare is going to help them, but another report sourced from Kaiser found 77% of consumers simply don't know the basics about the insurance marketplace that opens today. So, can you walk us through who can sign up and how can they do it?
Well, anybody can go to the site now, Chris. It just opened up at 8 a.m. Eastern. We've already been on this site, and by the judge of things, it seems like traffic is actually pretty high. We looked at the state of Georgia, for example. They're already saying that there's so many visitors that the site is not open for everybody right now because they're getting a lot of traffic. So it gives a little bit of a sign of the interest in this. But you're absolutely right. There's still a lot of confusion. I would start off by saying this, Chris. For a lot of people out there who have insurance through their jobs, through their employers now, they haven't been focused on this, and in part for probably pretty good reason. Their lives may not change a lot. But for the 48 million or so people who are uninsured, this is really a very important day, a historic day for them potentially. So they get a chance to go on. Healthcare.gov is the website. I can tell you it's a 3-page application on there, Chris. And one of the things you won't see as part of that application are questions about your health, because that is not relevant to determining the price. That you can't discriminate based on pre-existing conditions. So it's you know, people go to the site, I think they're going to find what it is exactly. It may not be that complicated for them.
All right, so let's say once you get to the site, there are, 4 different levels of coverage to choose from? You know, they go different types of metals. How are they different? What do they mean?
Yeah, you know, just like when we pick our own insurance plans through CNN, I mean, it's a similar sort of thing. You have a platinum to a bronze. You pay more money on your premiums, you get lower copays and lower deductibles. You pay less money for a premium, you have higher copays and higher deductibles. So if you're someone who doesn't think you have any illnesses, you don't think you're going to get sick, you may want to pay lower premiums, but then you will pay the higher copay if you end up in the hospital. That's sort of the way the system is now. That's going to be the similar system on these this marketplace, Chris.
All right, one of the big sources of confusion, doctors. If someone signs up for insurance via the marketplace, will they still be able to choose their own doctor, keep their own doctor? You know the concern.
Yeah, you know, and I think, and I've looked into this quite a bit, and I think the best way to answer that is to say it is possible that you keep your own doctor, but if your doctor is now out of network because you picked an insurance plan where that doctor does not accept, then you may pay more to see that doctor, out of network expenses. Again, very similar to what people have now if they have insurance. This is going to sound familiar to them. But for people who don't have insurance, they don't have doctors, this has not been a concern because they don't have a doctor that they're trying to keep. So again, the vast majority of people who are joining this marketplace for the first time, this is sort of a new experience for them, Chris, in terms of actually having doctors that they will call their own.
But anybody that happens to where they don't get to keep their doctor, they're going to be sore, word is going to spread, it's going to be one of the doubts about the plan. One last question for you. A lot of this debate comes down to money. For people who don't currently have insurance, they likely don't have it because they can't afford it. So what do you think they can ballpark in terms of what people can expect to pay on average?
Well, if you fall into this group of people who are uninsured and now you're going to go to the marketplace to get insurance, the expectation is, and we're going to keep track of these numbers very closely, Chris, but the expectation is that about 6 in 10 people, 60%, will pay less than $100 a month for those premiums. So that's a pretty good deal. But you know, there are people who may pay more depending on where if they qualify for subsidies or other sorts of benefits. So, but about $100 a month roughly.
All right, Sanjay, thank you so much. If there had been any question, all doubt has been removed as to whether or not you are a rock star because you have your own tour bus. Look at that bad boy right there. Sanjay Gupta, MD, and look at the picture. Handsome and informative. Sanjay Gupta is on the tour.
As
You are
usual,
not.
You've made me blush. Thank you.
He's on this. He's going on his tour. He's rolling out. He's going to be in Lexington, Kentucky next. So if you're there, come out and see Sanjay. Looks good. You better have
We're getting
shades
people
on.
here
I
already.
hear envy coming from this table.
I can't even get a seat on the bus.
It's okay.
My best chance is Sanjay throwing me under the bus. Our thanks to Sanjay Gupta. Great information.
Thanks, Sanjay.